A conversation is made possible in part by the Mathewson Charitable Lead Trust.
In Canada, a young girl gets a second chance at life because a young Reno mother decided to give the gift of life. This is a conversation about organ donation. At the 2013, or actually, yes, it was the 2013 Rose Parade, a float honored the lives of organ donors. Among them was a young baby from Reno, Audrey, who died and became a donor at the age of 6 days. Audrey's heart now lives in the body of a young girl in British Columbia, and Audrey's mother, Felicia Hill, is here with us this morning, along with Sandy Andrada, Community Education Manager of Donate Life Nevada. Welcome.
Thank you.
First of all, it seems that the story of an organ donation never starts with a happy ending. Tell us a little bit about Audrey's story, Felicia.
Well, Audrey was born perfectly healthy, and at 3 days old, she stopped breathing in my arms. She was in the hospital for 3 days, and they decided that her brain was completely dead, and there was nothing they could do for her. And that's when organ donation was presented to me with an answer that I said, yes, absolutely.
Now, this is pretty amazing, the amount of information that you've gone through in such a short time. First of all, it sounds really heart-wrenching for us. This was, I'm assuming, your first child?
Yes.
And you have had other healthy surviving babies since?
Yes, I do have another child now.
That is wonderful. But in Audrey's case, there was no warning. You had her home, and she simply stopped breathing?
Correct. Yes, and they have no medical reason why. So for me, the reason why is so that she can save other people's lives.
And that sounds great in retrospect, but at the time, how did you deal with this?
I had a complete peace about it once she was admitted to the hospital. I just knew that something great was to happen and didn't really realize that it was turning into this amazing organ donation story that I now get to tell for years to come.
You have a remarkably upbeat attitude about the whole thing, and it is great. So you had not really thought about organ donation before they came to you after 3 days?
No, it was just a time for family and friends to come and say goodbye and for us to stay hopeful. And I was hopeful, but I was hopeful for another reason, not for Audrey, because I already knew that she was born to do something else besides be here. And so I just had a complete peace, like I say, that she was just born to save other people's lives.
That's wonderful. That sounds like faith. Is it based on perhaps a religious background that you have?
Definitely. I do know that, the Lord is my Savior and that nothing happens for just no reason. And I believe that things happen to glorify God, and He is glorified in this situation every day.
That is a wonderful attitude for us to all have. Well, meanwhile, while your drama was going on in British Columbia, another family was going through a very hard time. Elaine Young's daughter, Addison, had started life healthy, but she was failing fast.
Addison was not acting normal that day. She was very cold and pale. She was crying. She wouldn't eat. She just seemed unhappy about something, and we just thought there's something horribly wrong. We didn't think it was going to be that wrong. We took her to the hospital at Burnaby General at 4 in the afternoon. By midnight, we were here, and they were whisking her away into the ICU, and I'll never forget, they wouldn't let us see her. They just, we saw her just being rolled down the stretcher down the hallway, and they said, go wait in there. And then we sat in the waiting room, and then after maybe half an hour, the cardiologist came out, and he said, look, I'm really sorry to tell you this. He said, I'll never forget it. He said, your daughter might not make it. When he said that, you just think, this is a nightmare. This can't be our girl. We were just, at the mall 12 hours ago. We were at home. Everything was normal 12 hours ago, and now you're telling me that she is so sick that she could die. And it was like the world just fell apart, like everything just went black. It was horrible.
And that brings us to a point to talk about the organ donation process. And Sandy, I'm going to turn to you for a little help for this. We've seen probably two fairly typical families heading into this problem. We see a tragic death. We see a sudden failure of an organ. Probably neither family had really thought about the process.
Well, that's absolutely true. And when Elaine says that her world was turned upside down, we know that in Nevada today, there are 560 patients whose worlds have been turned upside down because they are currently waiting for that life-saving transplant. And I know that they never thought that they would end up on the waiting list. And then on the other side are families like Felicia's family. And in instances of organ donation, that trauma did happen very quickly. That death did come very soon. So the families did have very little time to discuss it in the hospital. And that's why we so encourage all the families in Nevada to speak about organ and tissue donation way before we ever see the walls of a hospital, that it's a conversation that we have in life, not in death.
That's a very good point. It's almost like life insurance. We don't like to think about it. We don't like to make plans for dying, but that is a very important plan. How does the mechanics of it work? How do you match donors and recipients?
So there is a national waiting list for patients who are waiting for a life-saving transplant. And that waiting list is based upon waiting time for kidneys or medical urgency for other organs. And then also based on blood type, height, weight. And when there is a donor in the hospital, either the donor themselves had registered to be an organ and tissue donor, and therefore, we're going to make that happen, that wish to be a donor happen, or their family has been asked about donation, and the family has consented, then we'll move forward with matching the donor's organs with waiting list patients. And that's when we coordinate with transplant centers to make the transplant happen.
So at some point, Felicia, had you basically said that your daughter could be an organ donor if that were necessary?
It was not until the doctor came in and pronounced the time of death and that there was nothing they could do for her. Then shortly after that, the organ donation community came in and asked me if I would like to donate her organs.
And I'm sure that's something that you approach very delicately at that point.
Absolutely. We dedicate a whole team of staff, many of whom have social work background, because we know that these families are experiencing very acute grieving and bereavement. So our staff are not just there to talk about organ tissue donation, but also to support our families through the entire grief process. And if the patient had registered, then it's simply informing the family about their wish to be an organ and tissue donor and helping the family understand the process. And if the patient's wish was not known, then our family care coordinators take the time to really help the family through the process, make sure that the family understands everything that's going on, and then talk to them about organ and tissue donation to determine whether it's the right decision for them.
Well, this is something that would just be unheard of in the 1950s or the 1960s. How is that information transmitted so quickly? Here we have a donor in Reno, Nevada, and we have a potential recipient in another country.
Right, and you're right, 50 years ago, in the 1950s, transplantation was unheard of. It was just beginning. And in the 80s is when a federal law was put into effect so that all hospitals would notify organ procurement organizations when a patient has passed away or is approaching brain death and could be a potential donor.
We will talk a little bit later about how you can help that process along. But I have to ask, how is Addison doing?
She's doing great. She has no rejection whatsoever, and she's just doing wonderful up there in Canada. She's 3 years old now. She has lots of attitude and spunk to her, and her parents get to enjoy her every day, which is what gives me the most peace, knowing that, I don't get to experience that with my first daughter, but they get to, and that means the world to me.
And that is great that you have a chance to follow up on her. Elaine Young, the mother of the little girl Addison who received Audrey's heart, has become, quite understandably, one of the spokeswomen for organ donation. And she's very well suited for that role because she's a television reporter in British Columbia. So she is very articulate. Last year, Felicia and Elaine got to meet in person long after the transplant. Elaine talked about that meeting in the event that brought them together, the Donate Life Walk in Santa Clara.
We have traveled 1,600 kilometers for the meeting of a lifetime.
Look, who's that?
But this journey spans the greatest depths of emotion for two families whose paths are now forever intertwined by two brave little girls.
Hi.
Hi, how are you?
Great. How about you?
In May 2011, while Addison was fighting for her life in Vancouver in desperate need of a new heart, Felicia Hill was at her newborn daughter's hospital bedside in Reno. Audrey inexplicably stopped breathing when she was just 3 days old. There was nothing more doctors could do, and at 6 days old, she became Nevada's youngest organ donor that year. Her heart now beats in our daughter's chest.
Thank you.
But unfortunately, there is no fairy tale ending to the transplant story, at least not yet. Addison, like all other transplant recipients, is on a toxic cocktail of immune suppression drugs for the rest of her life to prevent rejection.
For you to wear tomorrow.
You know who that is?
We are meeting in Santa Clara, just outside of San Francisco, to honor Audrey at the Donate Life Walk, organized by the California Transplant Donor Network.
This is Audrey's heart recipient, Addison, and this is Audrey's kidney recipient, Heidi. Addison! Addison!
That has to give you an unusual perspective. You've kind of seen the alpha and the omega of the process. How did it feel to actually meet the girl and her mother?
It felt amazing. All I wanted to do was just hug her and squeeze her and just give her some love and let her know that I love her and that, you know, it's been a dream come true meeting her in person. And just Elaine's thankfulness and everything that she has for me and the decision that I made, which it wasn't a decision I made. I believe it was a decision that God spoke through me to make so that this miracle could happen. And it was just an amazing experience that I'll never forget, just hugging her and holding Addison.
I think this meeting was largely your fault. You made it happen because you found a way to track down the organs.
Definitely. I did get a letter of appreciation from Addison's mom, Elaine, but there's certain rules through different organ donation transplant centers, and they were not able to say their names at the end of the letter. So I had no closure, nothing, no picture, nothing to hold on to besides, great, she's doing good, but I want to see this little girl. I want to know her, and I want to watch her grow up, hopefully, if they'll let me. And so I Googled it, Canadian Baby Heart Transplant 2011, and Elaine's blog popped up with the same exact letter that she sent me. And so I messaged her right away and I commented on it and I said, I'm your daughter's donor mom. And we immediately started talking, and she's been a part of my life ever since. They've sent me wedding gifts and baby shower gifts for Olivia, and it's just been a whole extended family that we just couldn't be more thankful to have a picture with the story and hugs and time spent last year. Everything just come together.
That's a wonderful gift that you've had. And Sandy, let me ask you, that was really only because this was an international transplant, wasn't it? Are there a different set of rules in this country if you want to be able to follow the organs and the recipient agrees?
Right. I think the difference came in that Canada has much stricter privacy laws surrounding donors and families and recipients meeting. Here in the United States, we definitely send a letter to both the donor family and the transplant doctors just to let them know general characteristics of the donor and the recipient. And if the donor family wants to write to the recipient or the recipient wants to write to the donor family, we help facilitate that communication. And after that first communication, which is blinded, if both sides want to meet, we help facilitate that meeting. So we know that it's very, like Felicia says, it's very helpful, a sense of closure for families to be able to meet each other. And they do become extended family. We've seen that with many of our donor family and recipient families. But there are some donor families that never get to meet their recipients, but they overwhelmingly still feel the same way, that they would never have made a different decision, that it did help bring them, hope and healing in a time of grieving.
And do you actually go back and check them and ask them if they've had second thoughts?
You know, we do. We follow up with our donor families 2 weeks, a month, 6 months, a year out, as long as they want to communicate with us, providing them with grief support. And we ask them, you know, what about the process did you like? Did you not like? What could we have done better? And we do ask them, would you do it again? And 99% say absolutely.
That's wonderful. Felicia, when we talked yesterday, you said that frequently we don't look at the donor family's perspective. We know that there's going to be a grateful family on the receiving end. But when we look beyond you, who obviously have this wonderful glowing attitude, how has it affected the rest of your life?
Well,
the rest of your family?
Definitely. It's the whole family. Organ donation is a big, huge circle of life that not a lot of people see the organ donation donor family side. And that's what I want to insinuate today, is that it gives us peace and hope and just all the positive emotions that people can get out of death. It's the brighter side of death, knowing that, you know, your loved one didn't pass away for just no reason. I mean, in my case, there was no medical reason whatsoever. How am I supposed to know why this happened to me? But when you do ask yourself those why questions, you're just gonna bury yourself deeper in negative emotions, which is never good. But for me, this organ donation process and everything that's come with it has just been closure and peace, and knowing that Audrey was born just for this reason. She was born to save Addison and Heidi. And for that, I just am completely thankful. And it's helped our whole entire family, knowing that, you know, my sisters, their niece, she didn't die for no reason. My mom, her granddaughter, had a purpose in her little life to save others. So the donor families, this really helps us a lot, knowing that, you know, there's a purpose in organ donation besides the recipient.
I'm sure that there was still grieving to do, but it was not as bad as it would have been if you hadn't seen that purpose.
Definitely not. And it's all about your attitude in life and your perspective and how you deal with things and your reaction to things in your life. And without this, I'm sure I could have gone about it a different way and been buried in sorrow and negative emotions, but I chose to turn it around and look at things the positive way, and that life is about other people. And Audrey knew that when she was born.
I think that we may need to keep your phone number on speed dial and call you occasionally to get a little bit of an attitude check. When we talked about facilitating some of the relationships between donor families and recipient families, if they want that, there's something that's very helpful in the Rose Parade that we saw. We mentioned that float right off the top. To honor the organ donors, both living and deceased, and to bring more attention to the gift of life, there is a float in the Rose Parade at the Tournament of Roses in Pasadena every year. Here's a look at the float that bore Audrey's picture in flowers.
What we have created every single year has truly become America's Donate Life celebration. We have activated a national community of individuals and organizations that are committed to helping people in need of transplants and also honoring people that have said yes to donation.
I'm a two-time living organ donor, and I like to volunteer and share my story and help out. And this is my first time doing a fluorograph, and I'm very excited to be able to do this for the family and hope to be able to meet them and see the final product on the Rose Parade float.
There's some families that can't come to Pasadena before Christmas, so our volunteers here in California decorate these images for the families, and then we send that portrait to the family so they can apply the finishing touches. We call those fluorograph finishing events, and we'll have over 75 of them this year, all across the country. We start with an image provided by the family. We posterize it to reduce the number of contrasting colors, and then you apply materials onto it, kind of like a paint by number. Except instead of using paints, you're using grains and coffee and seeds and flowers and other organic materials to create these beautiful lifelike portraits.
Johnny's my cousin. We were on vacation together and they got hit by a drunk driver. Unfortunately, Johnny didn't make it, but he was able to donate his kidneys, donate his liver to a couple of small children that are still around today because of what he was able to give them. Now it's been 21 years since that happened, and yet parts of them still live on, which is what's really cool about it.
The Donate Life float is about registering people to say yes to donation, and absolutely we want people to go to donatelifeamerica.org or at their DMV, check yes, and join our community and help others.
So Felicia, did you get to work on Audrey's picture?
I did get to put the finishing touches on, as well as my other family members. We had a fluorograph ceremony here that we got to finish it up. And it was looking amazing.
That's pretty amazing. And I will be looking for something different in the parades when I go back. One of the things that we just heard mentioned there is checking the box basically when you get your driver's license. I know that you talk to young people who are just about to get a driver's license about the importance of that.
Yes, I do a lot with CTDN, and I do a lot of...
And let's explain what that is. That's the California Transplant Donor Network?
Yes, sir.
Okay.
Yes. So I do a lot of volunteering and share Audrey's story whenever I can. We go to the high schools when they're doing their driver's ed classes, and that's the first opportunity that somebody really gets to decide whether they want to be an organ donor or not. And we just want everybody to make an informed decision, whether it be yes or no, because both answers are completely fine. But of course, we would like more organ donors, so we just explain what organ donation is to these teenagers and share the story, and hope that they would check yes on their permit or driver's license box when they get it.
Sandy, I'm sure that you deal with some fears, a little apprehension on the part of people. Maybe if I'm in an accident, the doctors and nurses won't try so hard to save me if I'm an organ donor. How do you deal with that?
Sure, I think Felicia and I hear that a lot when we're out at health fairs or festivals promoting Donate Life Nevada. And what we tell people is that the doctors and nurses, the EMT, they are absolutely there to save your life. In fact, they have nothing to do with organ and tissue donation or transplantation. Their only job at that point in time is to focus on your health and taking care of you. So that helps alleviate people's fears when we tell them that.
And there's also an interesting difference between organ donation and tissue donation, and most of us lay people don't necessarily make that distinction.
That's right. When people sign up on the Donate Life Nevada registry, they can sign up to be an organ and tissue donor. And why that's important is because less than 1% of us can actually become organ donors. Less than 1% of us will actually pass away from brain death and be on a ventilator in a hospital, and our organs be in a condition to donate for transplantation. But anybody, most people can be a tissue donor. You can donate cornea no matter your age. You can donate skin, muscle, connective tissue. There's so many different ways to help people.
Do you run into many concerns of a religious nature that maybe it's wrong to take part of one body and put it in another body?
Sure, so we've done a lot of work around that. In fact, if you go to our website at donatelifenevada.org or to donatelifeamerica.org, you'll find a lot of resources that we've talked to major religions, their faith leaders about organ and tissue donation, and we've found that every religion is based on compassion. And that means saving lives. And it's a personal decision for every person, but that overwhelmingly their religion supports it. For example, we receive a message from the Pope every year supporting organ and tissue donation. Past popes have shown their donor designation to the media, proving that they themselves want to be organ and tissue donors as well.
Okay, what's the next step? What if I'm convinced and I need to convince my wife or my mother or my father? What's the importance of having these conversations with families?
I think the importance is that you don't want to be in a spot where you're at the hospital, your loved one is on their last minutes or hours or days, and you're approached with that question. Your mind is fogged. It's, all cloudy. It's not thinking about the good that can come out of this, and it's not thinking about the positive. So just make this decision beforehand. Whenever you can, think about it and make an informed decision, know your facts, and know what great this can do for both the recipients and the donor families before you're in a situation where the answer could possibly be no, and somebody could, not be saved because of it. And it's just really important, because for me, it was no questions asked. It was just yes. Absolutely. I didn't have a thought process to go through to see, is this the right decision? Is it good? Who is it going to help? None of that. It was just yes for me. And it's not that easy for other people. And so I want people to think about it and talk about it before they're in a spot where they have to make that decision for one of their loved ones.
And the people around you need to know that you have made that decision.
Absolutely, and that's the big difference. If you personally want to be an organ tissue donor, you should sign up on the Donate Life Nevada registry today. But it is so very important to talk to your family, because if they don't know your decision, it will still be a struggle when they find out in the hospital.
Our guests have been two people intimately involved with organ donation, and they can tell us why it's called the gift of life. Felicia Hill is the mother of Audrey, an infant girl who donated her heart, and also the kidneys. We didn't get into that. They're living inside a grown woman right now, and we have seen that she has saved that second life through the donation of her kidneys. Sandy Andrada is trying to get more of us to sign up for organ and tissue donator. She's the community education manager for Donate Life Nevada and its parent organization, which is the California Transplant Donor Network. If you'd like more information, visit donatelifenevada.org. Thank you, Sandy, for sharing your information. Thank you, Felicia, for sharing your story and your daughter's organs. Thank you to Elaine Young and her employer, Global BC in Canada, and the BC Children's Hospital. And thank you for joining us for a conversation.
A conversation is made possible in part by the Mathewson Charitable Lead Trust.